Hi, my name is Meghana Keshavan, and I'm the life sciences reporter at MedCity News. I'm here speaking with Dr. Akhil Saklecha. He is the managing partner and a managing director and general partner, I'm so sorry, at Artiman Ventures. And we're going to be chatting today about investment opportunities in Asia. So I was wondering if you could talk to me a little bit about the overall healthcare environment in Asia.
Sure. Let me tell you a little bit about Artiman, and I'll tell you a little bit about how we look at Asia. So Artiman Ventures, we're an early stage venture capital firm, have just over $1 billion in total assets under management. Our perspective really is to look at three fundamental areas. We're first agnostic to sector, so we'll look at any area. Life sciences is one of them and probably represents about 20% of what we do. We also have companies in areas as diverse as agriculture, construction, real estate, semiconductor chips. Within life sciences, we've done a lot on diagnostics, software, as well as services. Now, the three things that we look at, other than being sector agnostic, is we look at white spaces where there's not really any competition. It's a wide open playing field. And we look at very large markets where we're talking about addressable markets north of $10 billion. So big problems, looking for big solutions. And our tilt towards Asia actually represents probably over a decade worth of work. We have an office in Bangalore, India, in addition to Palo Alto. And we have 4 companies in India and 1 in Taiwan, although a lot of our companies have back offices in Asia as well as customers.
Great. So what is that? So what is the healthcare market like then in Asia, and why are you looking in that direction as potential investment opportunities?
I think the way to look at Asia is if we take a higher level look at Asia and in comparison to the U.S. as well. So if we look at the U.S. at the highest level, you have a population 325 million people. You have a GDP that's growing at about 3% or so, and you have healthcare expenditure per capita that's probably the largest in the world at around $9,500. Now, if I look at India and China, so representing most of Asia, although Southeast Asia is also part of that, India has something very different. We have a population that's about 4 times larger, so 1.25 million people. We have a GDP that's growing at about 6%, and the healthcare expenditure per capita is about $60. So you're talking almost 200 times smaller than what's spent in the US. And if we go to China, it's larger, so you're talking about maybe 1.35, almost 1.4 billion people, and you have a GDP that's growing about the same as in India, but you've got a wider healthcare expenditure per capita of around 350. So if you look at that, the amount of money that's spent per capita is there's such a wide difference in India and China versus the U.S. But it's that difference is almost overwhelmingly significant when you compare it to the volume of tested or therapies or tests that you could run based on population. Now, that's just at the highest level, talking about macro numbers. If I go down specifically to life sciences, and if you break it down to, say, in healthcare, hospitals and physicians, in the U.S., you have about 800,000 doctors across all the different specialties in primary care, and you have about roughly about 5,000 hospitals. Most of them are nonprofit. There's some that are private, and there's academic centers. Now, if I go to India, I think I mentioned to you before about how many physicians there are in India.
Yes, that was a stunning statistic, really.
It's actually about the same as in the U.S. So imagine that you have about 800,000 doctors in India covering a population that's 4 times as large as the U.S. So it's such a wide difference. And if you talk about specialists, it's even wider. So in the U.S., you have about 20,000 oncologists covering medical, surgical, gynecological, oncology. If I go to India, you have 1,500 oncologists. It's a staggering difference. And if you go to China, it's similar, where you have roughly about 20,000 hospitals compared to about 10,000 in India. The Chinese hospitals actually are they're public, they're geared for government sponsored, and they're semi about 100 to 150 beds. In India, it's different. You've got 10,000 hospitals. A lot of them are private, and a lot of them are less than 30 beds, so you're covering 1 or 2 or 3 physicians. So vastly different markets, vastly different opportunities and paths to navigate through in those situations.
Yeah, absolutely. And I mean, on top of just the vast differences in the way that the healthcare systems are set up, I mean, there are differences in regulatory processes and reimbursements, right? Like, how is that
So
different as well?
yeah, actually, if I look at the, I think there's two parts to that question. So let's maybe tackle the regulatory piece
Sure.
first. So the U.S. has probably the standard across the world by its FDA process, and Europe has something similar with the CE mark. India and China actually in the past had very similar processes. They had their own versions of regulation. So they would try to tackle things along devices and around drugs on their own. They found that the processes weren't as stringent. There was a lot of workarounds. There was nothing really robust. And if you go back about 15 years, there was a lot of things that were being done around clinical trials, and there was a big move to shift clinical trials from the U.S. overseas, especially to India. Recently, India has tightened things up a lot. They've really put in a lot of regimented processes around regulation, and they've tightened the issues around clinical trials. There was a big public backlash around quote unquote experimenting on the population, and so India has tightened that process. China has similarly tightened the process. Their SFDA, or China FDA as it's now known, has really modeled itself after the US FDA. So, in one sense, understanding that there's a stringent regulatory process is critical, but it's very difficult for a US entity to go overseas and try to navigate that pathway on its own. It's just, I mean, even though we have companies in India, we actually use consultants just like we do in the US, and the same thing in other Asian countries. So it's very tough. Now, that being said, on reimbursement's actually interesting. So within reimbursement, India and China, just like the US, have a nationalized type of universal coverage. Now I say universal in the sense that it applies to a lot of people, although we're talking mainly to the lower socioeconomic status. And so if I look at China in particular, China recently implemented a rural reimbursement program. It was a private-public partnership mainly geared towards keeping things locally based as much as possible. By keeping things locally based, you were able to actually incentivize the patient to get care at their local hospitals. There was more coverage for local treatment. So if I ended up having a cardiac illness, I could go to my local hospital in my area, get treated, and about 80% of my cost was covered. Now, in certain cases, if I went to a larger, let's say a tier 1 type hospital in a major city, the patient actually has more responsibility on the cost. So the incentives were China would cover more of the cost if you stayed local. If you went more to a tier 1 institution, you're on the hook for more of it. In India, it's a little bit similar, although the cost there is roughly borne by, I'd say that the government oriented towards a lower, say 200 million population. The vast majority of India is actually private pay. Private insurance is really only about 15% of the market coverage in India and China and other Asian countries. So you really have a significant opportunity if you look at the converse of what private insurance and what public insurance is not covering. And what I mean by that is the self-pay market. So if you look at the self-pay market in India and China, you're looking at roughly 10 to 15% of the population that can really afford to pay real big dollars for their healthcare. So for instance, in India, you've got a population of about 100 to 150 million people that can pay thousands of dollars for their own type of healthcare. And that can be for surgeries, it can be for cancer treatment, it can be for diagnostic tests. A larger population, almost 200 million plus, exists in China for exactly the same, which is when they have a healthcare issue or they're motivated around healthcare, they will spend their actual money out of pocket for their healthcare, not only for themselves but for their family, and that runs the gamut from diagnostics through all the services and therapies as well. So it's a wide open potential to tap into the self-pay market in Asia. very different from the U.S., where in the U.S. The large majority is covered by either private insurance or Medicare, which will pay most of the money for care. The problem is in the U.S. is for people to spend real money out of their pocket it's a higher barrier. So the barrier is opposite here, which is insurance coverage versus lack of insurance coverage in Asia.
Wow. Well, thank you. That's an amazing overview of the healthcare system differences between the U.S. and Asia, I must say. So, can you tell me a little bit about what some of the investment opportunities might be in
Sure.
healthcare?
I think maybe the way to frame it is actually to look at how we look at problems in Asia. So when I was talking earlier about the number of physicians, it is, if you think about the number of physicians in India and China versus what we have in the U.S. versus the population there, it's staggering. It's very easy to think about cost as a big problem. It is a big problem in Asia, but the problem of access is probably overlooked. So if I have cancer, and if you talk about the middle class, which is rising in population and ability to pay, and then the rising incidence of cancer in Asia, especially because air quality is bad. You can't always, you have worry about toxic food. You worry about water that's bad. So the incidence of cancer is going up, and yet there's not enough oncologists there, right? So how do you address that access issue? So if we talk about cost, we talk about access, we talk about quality. So how do I monitor quality care in Asia? How do I know that I'm getting the best quality of care, or is it the standard of care as we like to call it here in the U.S.? And then there's a shift between urban and rural. So if I think about going after the big problems, access, cost, quality, urban versus rural, the opportunities really can be translated to say, how do I use technology to tackle those problems? Because it's not going to be brute force, it's not going to be tons of money put in. Technology really has to be leveraged to go after those problems. And so if I look at the wide spectrum of saying, is it drugs, is it device, is it technology, I'm very attracted towards the role of digital health, especially in Asia. Digital health is something where it's software. It can be scaled in the right venues. It can be managed at a cost-efficient point. And if you look at even one metric, just talking about smartphone use. So we were talking earlier, the number of phones in India is, you have 1.25 billion people. The number of phones is over 1 billion. That means that, obviously there's a lot of kids there. So people have more than one phone. And in fact, if you think about text messaging, it's the best way to communicate. There's WeChat in China, there's WhatsApp in India. The smartphone usage has increased tremendously. In fact, India and China China is actually neck and neck with the US on smartphone. India will be number 2 very soon. And you're talking this year, they'll probably cross 300 million smartphone users in India, and you're over that in China. So the way to approach India and China and the rest of Asia is not an incremental technology. Those countries will leapfrog what's gone on here in the U.S. and because we went from PCs to laptops to tablets to phone. In those countries, they started out with very large PCs. They're going to leapfrog through all of that and go directly to smartphones. And so companies that are here that are trying to say, how do we approach digital health in those countries? It's going to be leveraging the smartphone.
Sure. So, obviously digital health has much more of a potential in immediate, access for the country. But what about therapeutics? What about, all the specific therapies for the cancer that is rising? I mean, is there any opportunity?
There's actually a lot of opportunity. The trick is really to understand, how do I get, if I'm a U.S. entity, how do I get that therapeutic actually into China and into India? There's actually a lot of barriers, and it's not as easy as saying my therapy works here in the U.S. or works in Europe, and it should work automatically in China, for instance. If you think back, a lot of the clinical trials that have been done on a lot of drugs did not necessarily use race as a factor. It was often, and if you even go back to hypertension and cardiac therapies in the past, they're all done on middle-aged white males. And so it's very hard to say that drugs that have been used here can actually work in Asian populations. They could. I think there's a lot of work that needs to be proven. And so for a company to translate their product into an Asian marketplace, a lot of work has to be done based on clinical trials. So there may need to be new clinical trials that will stratify risk and population for different therapies. There may need to be new regulatory processes. And so for those companies to get into a country like, say, China, you really need to look at saying, okay, do I need a Chinese subsidiary in China? Do I need to find an agent? Do I license my technology or my device or my therapy to an entity in China? Is it going to be a JV? Is it going to be a wholly owned company? All of those things, and I'm not a lawyer, we have experiences in all those different areas. They all have pros and cons, and all of them need to be looked at by what specific business you're in and what you really want to do in China. The first thing, we have a diagnostic company that we launched in Taiwan because of its similarity in population and the clinical trials that we ran in Taiwanese patients. So there's a lot of overlap between the Taiwanese and Chinese populations. When we're looking to get into China, we're navigating through that partnership as we speak. We met a lot of different entities, and a lot of them were like, "We love what you're doing. Why don't we go ahead and take what you're doing? We'll take the exclusive license for your company's product into China." So it's a very scary concept for the entrepreneur because he's saying, "Wow, I'm giving up all of China to this joint venture, and I only own 49% of that. What does that mean exactly?" And so those are the things that you need to walk through in understanding what's the best alternative to do it. Is it better to actually go in China on your own with an employee as a representative or as an agent? So therapy, to get to your original question, has a vast amount of opportunity.
Yeah.
The question is, how do you get it in there? And how do you say that it works in Chinese patients?
Sure, and that makes a lot of sense. So when you're trying to launch a startup in an Asian country versus a U.S. Country, what are some of the differences in just procedure and like forming the basis of the startup?
So the way I would look at it is, if you're starting a company, the question is are you better off starting in the U.S. or are you better off saying, you know what, there's a bigger opportunity in Asia and I should start in Asia? So if you're starting in the U.S., then you have to say, I have a product that I can sell into India and China, and then do I need to create, as we mentioned, like a subsidiary in India or China? The problem is the ecosystems in both of those countries are still very early in the life sciences. If you are in e-commerce, you actually have an advantage because those ecosystems have been established. They're succeeding. There's actually probably very frothy situations going on right now in those situations. But if I was to look at specifically around life sciences, those ecosystems work only in certain areas where there's key opinion leaders, where you're tied into a large hospital partner, where you can get access to clinical patients, get access to physicians and labs. So you're talking about probably being in one of the top 10 cities there. And you really want to have the DNA of the company oriented towards the startup in that country. So, for instance, we have a company in India it's a diagnostic for cancer. That's one that we actually had the option of keeping here in the U.S. first versus starting in India. We decided that based on what they're doing, especially around a diagnostic to orient patients to the best possible therapy. And right now they're starting in breast cancer. We actually said, let's actually start it in India. It was a number of reasons. One was cost of the initial work to get started. One was around the right physician partnerships that we had, access to a lot of patients, and then the ability to say that we could start the company directly with Indian partnerships, directly with Indian regulatory approval, and launch it there at a lower cost with great quality. If we started it in the U.S., we'd have a lot of the same type of barriers as well as adoption, and you become noise in the system. So when we started it in India, it's just now starting to get to a commercialization stage. We found that the ability to scale that business and get it done at a lower cost was a significant advantage.
Great. Well, I think we have run out of time, but that was fascinating. Thank you so much.
Thank you. Enjoyed it.